I want to talk to you now about angina and angina therapies. So angina, well, first of all, what is angina? And it's chest pain or discomfort that people experience when there's a partial blockage of one of the coronary arteries. Often people will get the angina symptoms when they're exerting themselves. So the most common time is when somebody's doing a high level of exertion initially. There can be other triggers too, like cold temperature or after having a large meal, or sometimes emotional situations can trigger the angina as well. And as far as the way the angina presents itself, it can be different for different people. So you need to be aware of what your angina symptoms are like. The typical kind of textbook definition is where people have chest pain, often feeling like they have somebody sitting on their chest, or it may be radiating into their neck or into their arm, often the left arm, or even back or jaw pain. Those are all kind of the typical presentations. Sometimes it can be less obvious than that. It may even just be a feeling of anxiety or shortness of breath. So you have to be aware of what your specific angina symptoms are. And then we need to look and see what things may be useful for treating it. And the most common thing that we would use would be the short-acting nitrates, so usually a nitroglycerin spray. Nitroglycerin works very rapidly to reduce the angina pain, and it does that by reducing your blood pressure. So it drops the blood pressure rapidly, and that allows your heart to have less work to do. It has less pressure to beat against, and so it uses less oxygen, and it's able to accommodate with that lower blood pressure more rapidly. When that happens, the blood pressure lowering tends to cause some dizziness for a lot of people. So the first time you use nitroglycerin, you need to do it in a seated position, just in case you feel dizzy or lightheaded, so that you don't fall down. What I typically tell people is that nitroglycerin works best if there's some vertical posture. So when you're using it, it actually works better to be in a seated position or in a semi-reclined position, like in a lazy boy, than it does to lie right flat. So if you lie right down flat, you may not get as rapid of relief of the angina symptoms as you would if you have some vertical difference between your head and feet. Some people feel like they really have to lie down when they have that angina pain, and it's fine if the nitroglycerin is starting to work, you can go ahead and lie down. If the nitroglycerin isn't working, we usually say you can use 2 sprays. If that second spray hasn't worked, so about 5 minutes after the first one, then you need to start thinking about going to the emergency department, so dialing 911 and getting there. You can, of course, use another dose again after you've dialed 911, but we want to make sure you get to the hospital early if that chest pain's not resolving. People who have angina more frequently may actually require a longer-acting nitroglycerin as well, and that would be in the form of a patch. So a nitroglycerin patch that provides a long-term steady release of nitroglycerin through the whole day. Typically that's put on in the morning and taken off in the evening if the person's having angina during the day. If you're having angina at night, that could be reversed, and you put the patch on at night and take it off in the morning. There is a period of time, usually 10 hours or so, that you need to have the patch off in order for it to be effective, though. We call that the nitrate-free period. So you have the patch on for 10 or 14 hours a day and off for 10 hours a day. You can still use the nitroglycerin spray if you're having angina while the patch is on, so there's no problem with doing that. You can't really get addicted to the nitroglycerin spray, so there's no risk for using extra doses if you have to. Don't be worried about that at all. The other consideration with this would be if the patch isn't working, or if the nitro spray is having to be used more frequently, then that may be an indication that you have to use a different therapy. And commonly we would go on to be using more invasive therapies like angioplasty or coronary artery bypass graft surgery. Those things will actually get around the blockage and resolve the problem right away. But a lot of times doctors will want to treat with the medical treatment first.